Good day. My name is Rupak Chattopadhyay. I'm the President and the CEO of the Forum of Federations based here in Ottawa. I want to start by thanking Matthias Bianchi of Asuntos del Sur for inviting me to participate in this very important global forum dealing with the issue of governing the pandemic and the challenges of building collaborative governance. This is a very, very timely conference given everything that's going on in the world and how we've all been affected in our personal lives as well as in our work. The plenary session that my talk addresses today is that of intergovernmental collaboration, dynamics of our participation. The organizers and hosts today have asked me to address the issue of intergovernmental collaboration, and this is a very, very key issue in many federal countries. As of June 2021, over 175 million people had reportedly been infected by COVID around the globe, resulting in almost 4 million deaths. Half of these fatalities occurred in just 9 countries across 4 continents. 9 federal countries, or countries that are very highly decentralized, including the United States, India, Brazil, Russia, Germany, Mexico, Italy, Spain, and the United Kingdom. This distribution underscores both the global footprint of the crisis as well as the extent to which some of the world's largest economies and most developed countries are impacted by it, but also the fact that federations make up a disproportionate number of the world's largest economies as well as the largest countries by population. By their very nature, federations are more complex than unitary states. In unitary states, where national governments are assigned all powers, there is a single point of decision making. In federal states with devolved constitutional responsibilities, decision nodes exist at 2 and sometimes 3 levels. COVID 19 is more than just a public health crisis. Not just have governments had to deal with containing the virus and dealing with the health related fallouts, but they've also had to balance this with maintaining economic activity and livelihoods. The economic dislocation caused by the crisis has had a massive impact on the lives and livelihoods of people everywhere, particularly those who exist on the margins of society. This has required governments to step in with enormous income support programs. Further economic disruptions have had a massive impact on public finances everywhere, and governments have had to rapidly pivot in the direction of Keynesian fiscal policy, aimed at providing both income support and stimulus to raise aggregate demand. The experience of the last year and a half has demonstrated that no one order of government can cope with a crisis of this magnitude on its own. In most federal countries, we see that healthcare delivery, even when is a shared competency, lies primarily in the jurisdiction of subnational governments, both provincial but also in many cases local. Whereas pandemic management is often in the hands of national governments or federal governments, and therefore throughout the crisis, various orders of government have had to learn to collaborate and work more closely with each other. The crisis of the last year and a half has highlighted a number of ways in which governments are interacting in all federations and a number of trends which are likely to remain in place for the foreseeable future. Let me turn first to the issue of intergovernmental relations and coordination. In every country around the world, we have seen much greater levels of intergovernmental coordination and collaboration than in the past. There are, of course, exceptions to this. But even in countries with weak intergovernmental institutions such as Spain or India, or in countries like Canada, where there are strong intergovernmental processes but no statutory institutions, the heads of national governments have met with their provincial and state counterparts more often in the last year than in the previous 15 or 20 years, because the scale of the crisis is such that much of the decision making is very, very highly political. Whereas in most of these countries, previous intergovernmental relations were often restricted to sectoral areas, health, education, finance, environment, and much of the work at these forums were largely technical, whether they were in terms of exchange of information or coordination at the official level. A lot of the decision making around COVID 19 has been highly political and has therefore needed intervention by executives at the federal or national level, as well as at the subnational level. Decisions on when to impose lockdown, the lengths of these lockdowns, what sort of businesses to be kept open. These are all intensely political decisions, and therefore the political heads of national as well as subnational governments, have had to interact very, very closely in making these decisions. Right. A second important trend that we have seen in most countries is the collapse or certainly the stress in subnational finances, whether at the provincial or state level or at the local level, because of a collapse in economic activities and a drying up of the normal sources of revenues. And therefore, even in the most highly decentralized federations like Canada, where most provincial governments are fiscally autonomous, federal governments have had to step in to provide them with additional funding. The scale of the crisis is best illustrated with a few examples. In May 2020, the OECD suggested that Germany was predicted to suffer a year-on-year reduction of tax revenues of about 11% for the state governments and 15% for municipalities. The economy during the same period contracted by about 5.5%. In India, where the economy contracted by about 8%, despite fiscal transfers and tax revenues, 15 of the largest states saw their revenues decline by 14% over the period April 2020 to January 21. Okay. To be sure, a decline or an upending of economic activity everywhere has had an impact on public finances at all levels of government. But the fact of the matter is, the federal governments are very well placed to create money or to monetize debt, which is an option not available to subnational governments at the provincial and local levels. And therefore, these subnational governments, even in the most autonomous, fiscally autonomous, and decentralized federations like Canada, where most provinces raise 90% of their own source revenue, these subnational governments have had to turn to federal governments for bailouts. The final general trend I want to highlight in the case of federations is the emergence of local governments as a very important actor. Over the course of the pandemic, it's become very clear in even highly centralized countries that subnational governments, particularly local governments, have a very important role to play in pandemic management. In many federations, even when local and metropolitan governments are not constitutionally recognized, they are the order of government closest to people and are often the ones most responsive to the needs of the community. With the exception of a few countries, local governments were an indispensable part of national strategies to avoid blanket lockdowns. In the vast majority of cases, local governments, urban and rural, were at the forefront of enforcing local restrictions, organizing testing and tracing, and in some cases delivering COVID relief. Indeed, federal and constituent unit governments relied on local governments in countries as widely as Austria, Belgium, Brazil, Canada, Mexico, India, Italy, Spain, to be proactive in implementing more stringent measures than those mandated by higher order governments in response to local public health conditions. Given that most outbreaks often started in the community, local governments had a very important role to play in early warning and surveillance that allowed them to clamp down and isolate clusters of infection before they spread more widely. So, in the course of the last year, what have we learned, and what is the roadmap ahead? I think the first lesson we take away from this is the importance and indispensability of robust intergovernmental mechanisms to coordinate actions. If one were to look at the data in terms of outcomes measured in deaths per 100,000 population or case fatality ratios, the countries that have performed worst are the ones where there haven't been really much collaboration between the national and subnational governments. Second lesson is that federalism provides a laboratory for experimentation at the subnational level that can then be replicated across the country. And here we've seen many cases. The most common thing I think we've seen across all countries, which started with very blunt lockdowns at the beginning of the pandemic, is the importance and the appreciation of the need for more graduated responses, starting with the local level, uh, scaling up to the provincial level, and then being replicated across provinces. We have some examples from Argentina, where provinces pooled resources in order to share things like ventilators or medical staff, depending on where cases were surging. A third thing we've learned is the existence and presence of higher caseloads in urban areas. So going forward, countries, as they invest in improving their healthcare infrastructure, I think countries will need to invest more in better surveillance and monitoring of public health issues, particularly in urban areas, and reinforce the capacity of local governments if they want to maintain the resilience of their economies and avoid the sort of blunt lockdowns that happened during the first phase of the pandemic. Another trend I think we've seen, and I think this will only accelerate going forward, is that of digitization in service delivery. In countries like Canada, where healthcare is a provincial subject and where governments have often talked about the sanctity of data privacy as a reason not to digitize the delivery of healthcare, the pandemic did a wonderful job of pushing public policy to the next level. And I think we will see this replicated across service delivery, not just in Canada, but also in the emerging world. Digitization will, of course, improve service delivery, but will also raise new questions, such as forcing different jurisdictions to work together in order to make their data comparable and and to allow for data sharing without compromising on issues of privacy in data management. Lastly, I return to this again, the issue of subnational finances. It seems to me that for the foreseeable future, state governments, provincial governments will remain reliant on transfers from federal and national governments. And one is likely to see, at least in the short to medium term, possibly greater centralization on policymaking, including in areas which may have been the exclusive jurisdiction of subnational governments. Thank you very much.